Hey, it's Will for HairGuard. So ketoconazole, will it help stop hair loss? Actually, ketoconazole is considered one of the big three in the hair loss world, as in the top three treatments alongside minoxidil and finasteride. But is its place in the top three well-deserved or overhyped? If you're looking for a shampoo that could stop hair loss, then this video is for you, and reveal the best way to use it to get maximum results, so stay tuned. Ketoconazole shampoo is a medicated shampoo that you can pick up in most countries without a prescription. Ketoconazole is an old drug first brought to market in the 1970s with strong antimicrobial and antifungal properties. The indication of this treatment is dandruff and seborrheic dermatitis, both of which are thought to be related to fungal activity. In particular, that of a fungus called Malassezia. This is a fungus that normally lives on the human skin and scalp, but can cause problems when its numbers grow out of control. The patent for ketoconazole shampoo has long expired, and you can now grab a bottle for as low as a couple of dollars, depending on which part of the world you live. It's one of the first line medications. Up to 80 or 90% of dandruff patients will see good to excellent results within 4 weeks. And in the past 25 years or so, we've gotten substantial evidence that ketoconazole is also effective against pattern hair loss. Okay, so what's the evidence? The very first study to look at ketoconazole's hair growth properties was funded by Janssen, the company behind the original branded Nizoral shampoo. And to this day, it remains one of the single best pieces of evidence we have for ketoconazole's effectiveness. The study followed a group of young balding men, 27 of whom were assigned to shampoo exclusively with Nizoral, whilst 12 used an off-the-shelf supermarket shampoo. To measure the results, the researchers used a composite measure called pillary index, or PI. This is the proportion of hairs in the anagen active growth phase multiplied by the average hair shaft diameter. So the more hairs you have that are actively growing and the thicker they are, the higher the PI. Over 21 months, the men who used the unmedicated shampoo showed a slow but steady decline in their PI as their baldness followed its natural course. But the men who used ketoconazole had a steady increase during the 15 months of use. Their PI then plateaued between 15 months and 21, but did so at a much higher level compared to the control group. Following on from these very encouraging results, the researchers decided to directly compare ketoconazole shampoo with Rogaine 2%. This was a much smaller sub-study with 4 men in either treatment group. After 6 months of use, Nizoral shampoo gave an average 18% increase in density, which compared to 11% for the Rogaine group. The study authors concluded, quote, "We are compelled to conclude that regular use of 2% ketoconazole shampoo may participate to improve the AGA presentation," which is a fancy way of saying it worked. However, a further controlled study is necessary to confirm the findings in a larger group of patients, both to evaluate the ideal dosage and formulation and to fully assess the desirability of routine treatment with topical ketoconazole in this condition. However, Janssen, the only entity with the interest and financial capacity to conduct this follow-up study, never went forward with it. So all we got over the years was a few small, generally poorly conducted studies from independent researchers. Most of them mixed ketoconazole with other active ingredients, making it impossible to assess what improvement was down to the ketoconazole itself. But a 2000 study out of Japan is the exception to this. This was much smaller with only 6 men and did not measure any hair parameters. What it lacked in size and measurements, though, it made up for in terms of photographic evidence, something which the published Janssen paper had none of. The 6 men were aged 23 to 51. They applied topical Nizoral lotion 2%, not the shampoo per se, daily, immediately after using their normal shampoo. And they followed up for 10 to 12 months. The 2 youngest men in the group had dramatic results. You can see here the before and afters of a 25-year-old male who applied the lotion non-stop for 10 months. And these are the photos at the baseline and after 12 months for a 23-year-old participant. The baseline photo is A at the top left, and the second photo is after 6 months. The next photo in the sequence C shows his hair loss getting worse around the 9-month mark after he had stopped using the lotion for 3 months. This is followed by a dramatic improvement at the 12-month mark after he had resumed daily use. It's worth noting that only the 2 youngest men in the study had these results. The 4 older ones, ages between 31 and 51, had either no improvement or very modest response at best. So how to explain these results? Nobody knows for sure how ketoconazole shampoo works. One explanation is that its antimicrobial and antifungal properties are directly responsible for the improvement in hair loss symptoms. You see, inflammation is a common finding in balding scalps, a chronic low-level inflammation of the space around the hair follicles. Some authors have suggested that at least part of the inflammation might be related to scalp microorganisms on the scalp, and through its antimicrobial action, ketoconazole counters this inflammation. Another explanation has to do with the fact that ketoconazole is a weak anti-androgen. It's possible that when directly applied to the scalp, it inhibits the action of DHT to some degree. Another explanation relates to ketoconazole's regulation of scalp sebum. This is an oily substance naturally produced on the scalp and secreted by specialized structures called sebaceous glands. In balding scalp, these sebaceous glands are noticeably enlarged, and ketoconazole can help reverse this enlargement. The problem is we don't understand if this sebum dysregulation is a cause or an effect of baldness. So how to use it? Ketoconazole shampoos come in 1% and 2% strengths. Anecdotally, both are effective, though 2% is probably better. Most people who use it for hair loss do so 2 to 3 times a week. After massaging it into the scalp, leave it on for a minimum of 5 minutes before rinsing it off, and ideally up to 10 minutes. With ketoconazole shampoo, it's important not to go crazy. Always remember, this is a medication, not just a regular shampoo. If you start using it excessively, you're more likely to stop treatment altogether rather than to get your hair back. So don't be overly excessive or obsessive about it. So guys, what about the side effects? Now, unlike the oral version, topical ketoconazole is generally a safe drug. It's not absorbed into the blood and has no systemic side effects. Having said that, it's not the most pleasant shampoo. While it's generally useful in relieving the symptoms of dandruff, including itchiness, it can sometimes increase itchiness, at least temporarily. It will also dry your scalp and hair, as it's very effective at stripping away the sebum. So you will end up with hair that is dry, lifeless, and very difficult to style, unfortunately. For this reason, many users use a second shampoo immediately after Nizoral just to restore their hair's appearance and allow a bit of styling. Excessive use might lead to severe dryness and rashes, leading you to stop use altogether. So what's our take? Although it's not approved as a shampoo for baldness, ketoconazole shampoo almost certainly has anti-hair loss properties. At this point, there are simply too many studies to ignore. Ketoconazole for hair loss also has won the market test. That is, it's become very popular among hair loss sufferers, and its use spreads by word of mouth. This is in spite of the fact that it is not advertised for this indication, and most doctors will not prescribe it for hair loss. So we can agree that ketoconazole works against hair loss. The million-dollar question is, how well? The answer for most men is not well enough to be used as a standalone treatment. Then you're not going to reverse your hair loss by ketoconazole alone. Most likely it will stabilize your hair loss, and if it does give new hair regrowth, that will be mild. The vast majority of guys will have to combine ketoconazole with something else. You also have to be careful not to use it too frequently, as you'll only increase the risk of side effects and discomfort without getting any additional benefits. So even though it doesn't generally require a prescription, you can't go wrong by running all of this past your doctor. Lastly, if you do decide to start Nizoral, our advice would be to have your hair as short as possible. The longer it is, the more dry, tangled, and lifeless it will become. So keep it simple, keep it short, is a good piece of advice. When it comes to shampoo, I want to use something that's natural, kind to my hair and scalp, and yet powerfully promotes hair growth. That's why I go for the Hair Guard Caffeine Shampoo. It contains a powerful mix of hair growth stimulants and DHT blockers, along with gentle natural cleansers. It won't leave your hair thin or lifeless afterwards. And we've also got Maxoxidil, which is a powerful topical stimulant like minoxidil but with maximum power. Head over to hairguard.com to find out more. So that's it for this video. If you've got any questions or comments, drop them below. I respond to them all individually. So thanks for watching, and I'll see you in the next video.